Hello everyone, this is Ariana, aka the Melanin Nurse, and today I'd like to talk about how I became a nursing student technician. So first, I would like to let everybody know, to become a nursing student technician, you must have completed one clinical rotation. So usually there's a lecture, a lab, and a clinical whenever you get in your first actual year of nursing school after your pre-nursing year. So usually for most hospitals, that's what it takes to get in to be a nursing student technician. And usually people ask, what is a nursing student technician? So usually they do patient care, basically taking any of the needs of the patient. If they need help turning, they need help cleaning themselves up, they need help with feeds, they need help with, well, definitely number one is the vital signs. So they do their blood pressure, the pulse ox, respirations, blood pressure, all of it. Also, after you get to a certain point in your nursing program, you can also do IV takeouts. So taking out the IV, taking out catheters, Foley catheters. There's other suction catheters that actually, depending on the hospital, you can take out, changing Foley bags. So you could do that. And also you could take blood as a nursing technician. So it gives you a lot of experience. I work at Summa Health System. This is what my badge looks like. Says I am a tech. I have like a few little stroke tags on here. Have aided. Be doing a video on that so you guys know how to take care of your patients. And also, it just says Summa Health. I have my flu. Make sure you get your flu shots. You need them anyway, but yeah, get the flu shot. I got it at my job. It just says nursing. Oh, Jesus. Nursing, and it says nursing student technician. So yes, that is my badge. I also have another badge for my clinical. I just got this one recently. This is at Cleveland Clinic. So I'm stepping up. I have like 3 badges. You get a lot of badges when you're a nursing student. But now I have 5 major tips on how to make sure you snag that job. Number 1, make sure you have some credible recommendations, not references, recommendations. Some people that can give you a good reference or recommendation to work there. So if it's a boss, that's good. Anybody from a scholarship committee, anybody from your past jobs who are directors, anybody. But most importantly, it's good to get a reference from a clinical instructor. So if you are basically a new nursing student going into your first clinical, make sure that you do your best to stay as close to your clinical instructor as possible because they could be giving you a review. Usually for nursing technician jobs, you need at least 1 clinical instructor. So it's very important. The one I had was very nice. She was a great instructor, and I'm glad that she was able to give me one. But if she wasn't, I would kind of be stuck. I wouldn't be able to get the job because it's required once you do your interview. Usually, it's usually before or after, but for my job, I had to do my references after my interview, and then they would let me know if I got the job. So that's important. Number 2, I really wouldn't think that grades are important. Now they do get your transcript, but they really do not look at any grades. So although it's important to keep your grades for nursing school, I think they do know how hard the classes are. Sometimes that C+ is you passing. If they see a C+, usually people are like, oh, she got a C, that's not good. But usually a C+ is not bad in the nursing school. You made it. You made a pass. You passed. You got the grade. You did not fail. So that's a good thing. So I would let everybody know that grades is not the biggest factor. Usually the reference is to see how you are in a clinical setting. 3, dress professional to your interview. Sometimes people wear their white coat and a nice black and white outfit. I wore a blazer, very professional, wore my white and black, wore some heels. I brought my badge with me. This badge, I didn't have these badges. This badge just says I'm a nursing student at the University of Akron. I wore that with my outfit because I didn't feel like wearing the jacket. I wore a blazer, so I couldn't really put it underneath. So I did do that. Make sure you come with questions about the hospital. They want to know if you know a little bit about the hospital, what you like about the hospital. I got asked a good question, what are my weaknesses and my strengths? Make sure you actually have a personalized answer. Don't just say, oh, my weakness is this and that, but my strength is showing up on time. Those were kind of rhetorical questions. I know for mine, I said my weakness was empathy. I empathize with people. You know, I really do have a hard time, like, sometimes getting to reality. Like, I just feel so bad for that patient. I really put myself in their shoes, and sometimes it's hard to get out of that. But it ended up working out because my unit director agreed with me. She did agree. She said, that is my exact same problem. I sympathize with people a lot. I have a lot of empathy, so that's a good thing. One of my strengths is I get the job done. Not that I'm always on time, but that I'm able to juggle things at once. Even though people say multitasking, you're not really focusing on one thing at once. I'm able to time management to where I'm giving my effort all in all those certain areas. Make sure that you know how to answer those questions. Number 4, make sure you bring your resume. Even though you already submitted your resume probably with your application, bring your resume. It looks very professional, just so they could get another look at it while they're interviewing you. Make sure it has some involvement in there. Make sure it has your GPA in there. Make sure it has some of your skills in there. I put my skills on my resume. So I would put range of motion, vital signs, dry, sterile, dressing, change, anything that you could put to make yourself stand out. Any skills that people might not have thought to put on there. They're all important if you learn them in class. And number 5, put some involvement in there. Sometimes they want somebody who isn't just, I'm a nursing student, that's all I do. Like, be involved. I'm involved in a few organizations and honor societies that I definitely think help me stand out a little bit. Because honestly, a nursing student technician job is very, very competitive. So they want to see who's going to stand out a little bit. They're just not going to randomly pick people. They're going to pick people whose application stood out to them and who they would want to join their team. So without further ado, if you guys have any questions, please put them in the comments and like and subscribe. Thank you. Bye.